Hello and welcome to my video about autistic catatonia. I'm producing this video because some of my friends on the internet asked me for some information about catatonia because I went through it. And I thought that I would actually start with a story. It's a real story. It comes from an online forum that I participate in, which is for people with moderate to severe autism. It's on Reddit. And somebody not long ago posted a question there because they really wanted to help their sister who was starting to struggle in new ways. And I think what I'm going to do is to show you the post. We'll go over the whole thing, and then we're going to talk about what in this post sounds like it might be catatonia. So I'm going to read over the whole thing, and then I'm just going to go over it piece by piece and talk about every element in this story which illustrates a possible feature of catatonia or something to look out for. So this post is by Bee Needs Honey, and it starts, "My sister is turning 16 this year, and the transition into the first few years of high school has been tough. In elementary school, she had a wonderful teaching assistant who knew her well and would stay with her in class, help her participate in activities with classmates, encourage her to eat lunch, etc. Her first high school was really rough, and the teaching assistants there would send her home with a full lunch bag. Her clothes would be untidy, and she would have small injuries to her hands. After meeting with the school board several times, she's finally into a good high school with a great teaching assistant. She mostly stays with a special needs class and has one regular class she goes to with her teaching assistant. The main issue is that she stopped doing the most basic tasks at home. Before starting high school, she would help wash herself, clothe herself, feed herself. Even with prompting, she could ask you for more food. She was even helping out with making her bed and doing laundry. Now she refuses to even get out of bed. If you ask her to do something and try to hold her hand to bring her toward the activity or action, she makes her whole body stiff. She's now spending long periods of time just standing or staying sat. This happens at home almost every day now, but according to school staff, she only does this on occasion. My family lives in Canada. My mom is her primary carer, and I work abroad in the UK. My brother is also in university. I'm worried because my mom is getting older. Having her bend down to help my sister put on pants because she won't lift up her legs is not a long-term solution. So this is clearly a really tough situation for the family, but most of all for the person who's going through new medical problems and isn't able to communicate about them, right? That's very scary. And having been in this position, even as someone who can mostly speak, I can say it was very scary. If you go through catatonia, it often happens that even if you're normally speaking, you may lose the ability to speak. And that's what happened to me. But I think it's even more challenging if you don't have that privilege most of the time. So what I want to do now is to go over this sentence by sentence because just about every detail of this story helps to illustrate some component of catatonia, especially it shows up in autistic people. And I want to go over it from this perspective first, and then I'm going to kind of broaden out to talk about some of the more clinical details of catatonia or other resources that you might seek out. So the first concept that I want to pull in here comes from the title of that story that we just looked at, where the poster asked for some tips to help my nonverbal autistic sister. This is very tricky because the person who was experiencing catatonia in this case doesn't speak. They never speak. That's just how their autism presents itself. But for people who do have some speech, a loss of speech can often be a sign that catatonia is really taking off. For a lot of us, that's a symptom of burnout in general. And the beginning of catatonia can often look like severe burnout. Some of the features of catatonia can be really difficult to spot because they look a lot like autism. Sometimes rocking back and forth, for instance, can be a sign of catatonia, or other forms of what we might call stimming as autistic people. If someone who doesn't have autism does one of those things, that might be a sign that they're dealing with catatonia. But for us, it's just like our normal, wonderful way of being in the world. So it's just a sign that it's important to be extra observant of some of the other features of catatonia that might emerge, but also notice if you're losing speech, right? If you're having a lot more verbal breakdowns than you normally do, if your vocabulary seems to be slipping and you don't know why. That's something that comes up a fair amount in autism communities, online fora, people asking, does anyone have experience with this? What could be going on? And it's not uncommon that it's a sign of catatonia. Keep an eye out. All right, so this story begins. My sister is turning 16 this year, and the transition into the first few years of high school has been tough. This is really typical that an autistic person might be going through some kind of major rite of passage, like starting a new school or entering adulthood in some way, or even going through a lesser transition, like moving from one city to another. And we see it at all phases of life. So it's not uncommon for people in late adolescence, but it can come up in adulthood. It can come up in childhood as well. And we'll look at other examples later on. And one of the reasons that these life transitions can be tough is because they often move us from environments where we had a lot of support. We understood what the routine was, and we got a lot of our own sort of interests fulfilled into an environment where we don't have those supports, we don't have those sources of interest, and everything is disorienting. So in the case of the young woman that we were just reading about, in her elementary school, she had great assistance and a lot to look forward to. And then as she moved toward high school, all of those things went away. And at the same time, there are signs that her parents see when she comes home that she's not able to eat for some reason, right? Maybe she's too anxious. Maybe she doesn't have the supports that she needs. Something's messing up her clothes and something's happening to her hands. We don't actually know what it was. And I really want to point out something, speaking as an autistic person, that didn't get flagged in the post and doesn't always get flagged in the reading that I do by neurotypical people about autistic people. There's some sign of minor violence or harassment that might be happening here that she's not able to report, right? What's happening to her hands? Is she just banging them up because she's having motor difficulties? Maybe, is someone bruising them? Is she being hurt in other ways? So it's important to note those minor signs of harm, not because families should panic or we should panic, but because it's a sign that something in the environment is off, something isn't right. And speaking for myself, I have often had small bruises or scratches that I can't identify the source of, right? Sometimes I come home and I think, oh my goodness, how did I do this? I'm not sure. So it's not just for families, it's also for autistic people, right? But if you notice that you're getting those scrapes, what's going on? Why is that? Is that a sign that you're becoming more clumsy? Because clumsiness can also be a sign of burnout or breakdown or a catatonic decline. Pay attention to those things, I guess. And just know, as family or as clinical specialists, you may not know exactly what sources of minor trauma or even major trauma may be affecting the autistic person in question. And that could be the case if they're nonverbal, but it can also be the case simply because of alexithymia or because of dissociation or other things that as autistic people we're a lot more prone to experience. So to return to the story of this young woman, we get an interlude where things start to get better. She's able to switch schools. She gets some support that she needs. And so a lot of the struggles that she was dealing with seem to be in the past. And that's great, but there's still a likelihood that those tough experiences are staying with her and are going to impact her, that she may not have recovered fully from that period of being really overwhelmed. Some of the anxiety may still be around. So what we're going to see is that she doesn't get all the way better right away. And her continued struggle takes the form of a loss of function, what looks like autistic regression. So the things that she used to be able to do, she can't do anymore, or she's not doing them anymore. She has trouble with ADLs, activities of daily living. These are basic forms of hygiene, right? Sometimes they're taking care of our environment. They're anything that you need to do in order to go through the world. And it's very common as people start to deal with increasing burnout and especially catatonia, that things which used to be pretty easy or routine suddenly become difficult and then impossible. It often is the case that as people start to struggle with this, they experience being stuck in the middle of these activities. And that's not something that came up in this story, but it might be that you're brushing your teeth and all of a sudden you freeze mid-movement, right? That inability to move. People sometimes use that language of being stuck or being frozen in order to describe this phase of catatonia. And that frozenness and stuckness is a real sign that you might be in a catatonic decline. That's true in general, but it's especially true for autistic people. Okay, negativism. This is a really big one. Okay, so in this post, the sister said, now she refuses to even get out of bed. That word refuse is really powerful here, right? As someone who's been catatonic, and if you're listening to this and you've been catatonic, you might think, well, wait a minute, refuse is a strong word here. I couldn't. I was unable to will myself to do what other people told me to do or what I wanted to do, right? So it looks like refusal. And we'll see even more detailed examples of this later because it's common for everybody who's dealing with catatonia, not just autistic people. But this is a really tricky symptom because it's so easy to misunderstand. And that's especially the case for people who don't talk a lot or don't talk at all in general because they can't express their intent. If you are a family member watching this and you think that your autistic child might be dealing with some catatonia and they seem to be increasingly rebellious or passive aggressive, that might not be rebellion or passive aggression. That actually can be a symptom of catatonia. And it's important to note that, partly so you can report it to a doctor, but also because if you get frustrated or you misunderstand what's happening, you can create some anxiety which makes the catatonia worse because it adds stress to the person's environment. So be really careful about what kind of intent you're attributing to a person's inability to do certain things or failure to do certain things, whether that's moving or talking or traveling like they normally do. Movement abnormalities. So in the story that we've just been talking about, this young woman stiffens up. There are a lot of different, really strange kinds of movement abnormality that are signs of catatonia, especially advancing catatonia. I'm going to show some video in a minute. And I say, as someone who's experienced some of these things, they're bizarre. I feel like I have the freedom to say that because I've been there. So this sort of strange stiffness, strange reactions to verbal commands, all of these things can be signs that something's not right because they all reflect motor difficulty that a person might be having. And catatonia is ultimately about motor difficulty a lot of the time. Withdrawal and staring. So this young woman seemed to kind of have backed off, right? And backed out of her environment. She's become really passive and withdrawn. This is a common feature of both autism and catatonia. So it's one of those things that can be difficult to spot. But if we see an increase in this kind of behavior or a real decrease in engagement with one's environment, with other people, and so on, that combined with other things is a real sign of the onset of catatonia. Intermittence. Okay, we're going to look at how and why this might happen in a minute, but it's not uncommon that when autistic people deal with catatonia, these symptoms are really prominent in some situations and not in others. It may be that they're really prominent at home and less so when people are out and about. And that can be frustrating for family because it might look like, again, rebellion, passive aggression, what have you, right? I know that I sometimes have looked like that to people that I've been living with, and I've read other accounts of it. That's why I flag it. But you might see someone who is really able to engage at some points or during the most stressful part of their daily routine. And then as soon as they make it home, they kind of crash. And it seems like they've become like a frozen sculpture or almost non-speaking. But that can be just part of how catatonia manifests itself. And then the last point, this sister writing is concerned because her little sister seems to be losing independence and needing more help. And she's concerned that this is going to become a long-term problem, not just for her sister, but also for her family and for her mother in particular, as her mom is getting older. I put a question mark here because there is often a question about whether catatonia is going to produce long-term declines. And ideally, the catatonia is caught and addressed very quickly and handled. And in those cases, people often see a full recovery. But it is possible that these kinds of declines can lead to a semi-permanent or a permanent loss of function. And that's one reason that I'm making this video and talking about these things in some detail, because it's an important topic with potentially really long-term consequences. Okay, so that gives us some sense of how that anecdote relates to the topic of catatonia generally. And it gives us a little bit of an overview of how catatonia might come up, maybe through one of these major transitions that doesn't go so well for some reason and produces a bunch of new challenges for a person, what it might look like, right? It might look like a combination of increasing severity of autistic symptoms coupled with bizarre or unfamiliar symptoms that raise questions for family or raise questions for the person going through these things. What I am going to get into now is more detailed. I want to begin by talking again about life transitions in more depth, because this is a big one. This is what happened to me. I went through a divorce. I went through a coming out process as an adult. I came out as a gay person, and those things together really threw me for an enormous loop. Combined with the pandemic, they led to a rise of this catatonic symptoms, which got pretty severe in my case. So these things could happen to you if you're 40 and in a job and seem to be doing very well, right? I was told at the time that I was too quote unquote high functioning to be going through catatonia. I was told this by an autism specialist, actually, and that it only happened to people in institutions, and that is false. So we're going to talk about a range of different moments in life that could lead you to being overwhelmed, right? And to having this kind of decline if you're not receiving enough support. I've given you an example of another young person who started to really struggle when she started high school. She started puberty and she went to senior school. She was in the UK. And as a result of these shifts, she started facing increasing demands at school. She had to manage her own schedule differently. She had a lot of teachers during the day instead of just a few. And she started to have the same kind of decline that the young woman that we've already talked about experienced. This is a really common kind of troubling transition. You move on in life in some way, and all of a sudden, you lose your old structure and your new structure requires a lot more flexibility. You can't be nearly so rigid anymore. You have to deal with a series of new environments every day. For instance, if you're a college student and you're going from building to building, if you are dealing with a promotion at work, which is a wonderful new advance in your career, but it requires more travel. So you don't have your home base in the same way. If you are living in an institutional setting, it may be that something has changed with your care home or with your staff so that you don't have access to the same comforting routines anymore. In any environment, you may be facing something that could overwhelm you. And a lot of people dealt with this in the pandemic, which I think is one reason we're seeing new awareness of catatonia, because it hit so many people really hard. Here are some examples of life transitions that might have this kind of effect. Starting a new school at just about any level. If you're a child or a young person and your family structure changes because someone passes, because there's a divorce, or maybe because you get a new sibling through either the birth of a sibling or through the creation of a blended family, that can be really overwhelming. coming out, right, as gay or trans, or going through a different transition that feels like a coming out, that can be really positive, but it can also be stressful. And you'll see that a lot of the things on this list are really positive. And that's what can make this really hard, because people don't want to let go of the transition, right? In fact, sometimes the transition is vital and it has to happen. But if it happens too quickly or without enough support, it could create this major crash. And in fact, that's one thing that I would really flag, right? Is often these causal transitions are wonderful things in life that people are really desperate to complete. We push, right? We push really hard to get to the other side of this stuff. And it's that push that can end up leading us to have that collapse. The answer is sometimes to kind of step back and rethink, and sometimes it's to go through with that passage, but with more support or in a different environment or at a slower pace. So, new functional demands. As I said, these life transitions create new tasks and problems. These kinds of functional demands can actually lead to catatonic breakdown, even if there's not a major life transition at stake. Sometimes being in an unhelpful environment, not having enough structure, not having enough routine, being in a setting that's too demanding, trying to be too independent, dealing with a social environment that's just totally overwhelming and not realistic for us. These things can all be factors in some kind of catatonic breakdown. Possible bullying or other trauma. I would say, based in my own experience and also my participation in a lot of autism communities at kind of a range of levels, bullying is one of the single greatest factors of burnout that I have seen, and it takes a lot of forms. And it's true for people at a lot of different phases of life and in a lot of different environments. And when it's severe, it can lead to catatonia, as can other forms of trauma. So the first thing I want to note is that PTSD itself, actual clinical PTSD, is pretty common among people with autism. 32 to 45% of people with autism are estimated to have PTSD. That's a pretty stark figure, right? And part of the reason for that is because autistic people are more easily traumatized in a certain sense. There are instances of fire alarms leading to PTSD in autistic people because they're so sudden and so startling, and it's difficult sometimes for us to put that kind of sensory overwhelm in context. And they also can be intensely painful for us due to our sensory sensitivities in a way that they aren't for other people. So they're traumatizing because extremely painful experiences are traumatizing. There are other examples here of things that might traumatize an autistic person that wouldn't traumatize a non-autistic person. But something which isn't mentioned here, which I would point out as an autistic person, is that we are sometimes more likely to have PTSD because we are more commonly harassed. We are more often the victims of abuse and of violent crime, and we have a harder time reporting those things. We're more prone to being deceived or gaslit about them. So there's also a possibility that someone undergoing catatonia has been through a crime, right? Has suffered some kind of violent abuse. And we shouldn't overlook that possibility simply by saying, oh, autistic people, well, any little thing, right, can traumatize them. Sometimes that seems to be the case from outsiders, but it's also true that we are a more vulnerable population precisely because of that perception. So beyond actual instigating circumstances of PTSD, there's some pretty run-of-the-mill social stressors: bullying, abuse, violence, exploitation that maybe don't rise to the level of trauma, but still suck. Negative, quote, institutional experiences described by some autistic people as feeling crushed. All of this language I am getting from this book, Catatonia, Shutdown and Breakdown in Autism. If we're in a workplace that is not at all prone to reward us for the quality of our labor, for instance, that has a lot of toxic politics that we have a hard time navigating, a place where popularity is extremely important in a way that is difficult for us to sort of work within as autistic people. Those are all things that could add to the possibility of a catatonic decline. Lack of diagnosis of autism, especially in high functioning people. I'll put that in quotes. That's not my language. That is the language in the book. I would phrase that differently, but I think we could say especially among people who tend to have low support needs or who are perceived as having low support needs. And I would also add to that point that an inappropriate diagnosis can be a real stressor here. So let's say that you were assessed and given a diagnosis of autism, but you didn't have a functional assessment, and so no one assessed your level of support needed. So you know you're autistic, but you're not eligible for a lot of support because you were given the level 1 in the US, and maybe that's actually not appropriate. So in that case, you might want to go see a psychologist and undergo a functional assessment to get a fuller understanding of what your support needs are. Feelings of guilt, pressure, underachievement, right? These are all the kinds of things that can lead to breakdown. Psychological stressors, these are things that we've kind of covered. Being overwhelmed in some way. Let's say that you're living in a building that suddenly has a lot of heavy construction happening, and it's going to happen for 18 months. At month 14, you may find yourself unable to get out of bed anymore because you just can't handle it anymore, right? That can be catatonic. This is one I added. This was not in any sources that I read. This is something I want to say as an autistic person. If you are unable to connect to your special interest for some reason, in my case, this happened to me, and it was because I had so much bureaucracy to deal with in my job and during the pandemic. And I was taking care of a lot of other people's needs at that time. So I didn't have time to do much other than survive. And that loss of connection to my own deep, weird, arcane interest was a major factor in my decline. I think this should receive more emphasis from clinicians. And I think it's a big deal regardless of your circumstances, because for us as autistic people, special interests are such a major source of resilience. So maybe you don't have time anymore to engage with your special interest. Maybe your special interest requires you to have access to a certain medium, like a television in a television room if you live in a home, like a computer, like books, right? Like materials for a hobby or a craft. Maybe your headphones broke or your speakers broke. I've known this to be an absolute crisis for some people. It would be for me. But I've also seen this online where people can't listen to their music anymore and start to deteriorate really rapidly. Maybe you had some kind of social connection to an internet group, to a single person, could be anything that allowed you to engage more deeply with this special interest, right? Maybe you spent time talking about it, or you spent time online interacting about it. That can be a real loss. Loss of access to the outdoors in some way, whether it's being able to see the outdoors through a window, getting out there on your own, or to other places that maybe you went by yourself or with other people that allowed you to engage with these special interests in some way. Inability to travel, right? And it's clear that all of these things can really spiral. As I lost mobility, I became less able to engage with my special interests. And that led things to get worse and worse and worse and worse. So pay attention. I think this is one that, as autistic people, we often overlook. And as families or caregivers of autistic people, it's really easy to not see, right? Because it's not obvious and it's about the absence of something important, but it's a big deal. And I wish there was more literature about it. Autistic regression. So again, this has to do with the general worsening of symptoms. The first one that I want to look at is called echolalia. It means that a person mimics another person's speech in the conversation. I should say that all of these little charts that you're going to see as I move forward into these slides actually come from a questionnaire called the Bush-Francis Catatonia Rating Scale, which is given to doctors to fill out to assess whether someone is catatonic and how catatonic they are. And each one of them has a scoring guide with it, because if you were actually to go to the hospital to be assessed for catatonia and a doctor was to use this rating scale, they would give you a higher score if you were dealing with a more extreme version of the symptom. This is actually something that we do all the time as people with autism, some of us more than others. But for instance, in my case, especially if I'm feeling tired or I'm kind of at the edge of not being able to speak anymore, If someone says to me, oh, it's a really lovely day outside, I might say, oh, it's a really lovely day outside, in exactly the same way with exactly the same inflection. Echolalia can pose some problems because it's common to autistic people, but it also happens a lot in catatonia. And even neurotypical people with catatonia might start to do this kind of repetition all the time. So, as always, with a trait like this, which occurs in both disorders, you want to look at where you are at baseline. In other words, on a normal day, when you're not dealing with burnout or possible catatonia, and see if anything has changed. Are you falling into this kind of repetition more or relying on it more in order to communicate? Do other people around you comment on it more? All right, verbigeration. Here again, this is a speech pattern that we fall into a lot in general, or we can, which can become more severe in catatonia. So echolalia, which we just looked at, was repeating someone else's words. Verbigeration is repeating a word or phrase which may not have come from your current conversational context at all. It might just be a word that you like. In the autism community, we often call this vocal stimming, meaning that you have a word that you like to say that might bring you comfort or that might help you regulate in some way, and you repeat it often, not because it communicates something to the people around you necessarily, but because it makes you feel okay. The clinical term for this kind of repetition is verbigeration. So if you see that your patterns of vocal stimming are changing, especially if they're becoming more frequent, that might be something to report to a doctor, and that might be a sign that you're dealing with verbigeration as a catatonic symptom. All of these symptoms together represent worsening or becoming more extreme of habits that we might already have as a result of being autistic. And a lot of these things, while they're called symptoms in a sense, because they're indicators that we might be autistic, aren't necessarily negative in daily life, right? Like vocal stimming is just, for a lot of people, a way to bring themselves some peace and a way to interact with their environment in a way that feels manageable. But if these things become quite a bit more extreme, they can be a sign of something deeper that is going wrong. There are many reasons that a person dealing with catatonia could start to struggle with their ADLs. Freezing or becoming stuck. We could stop in the middle of doing something, and the length of that freeze might be just a few seconds, or it might be several minutes. And sometimes it looks almost as if we've become a frozen sculpture, like somebody hit us with an ice wand or something. We will just hold an object in midair. But sometimes it happens when we're already in a pretty sedentary posture, right? We could be sitting down. Some people get caught in the bathroom, as the author of this passage points out. Sometimes people get stuck in bed. And the real way to tell if you are dealing with this phenomenon or not is in how you feel, right? It's not just that you don't want to get out of bed. It's that you feel like you couldn't move if you wanted to, or you feel like your body is staying very still. You sort of come back to yourself and realize that you've been very still for several seconds. You might not even know how much time has passed, and you think, how long have I been standing here like this or sitting here like this? That could be a catatonic symptom. One thing that happens to a lot of people is called prompt dependence. Prompt dependence basically means that you are relying on someone else to say, hey, have you finished brushing your teeth, right? Or even to just get your attention while you're kind of frozen in the middle of getting dressed, right? Having gotten half dressed and then sort of gotten frozen in space somewhere or sitting on the bed. This has happened to me in just about every living environment I've ever been in, where someone will catch me sort of staring off into space halfway through getting ready in the morning, and has had to sort of call my attention back to the task at hand and say, hey, are you ready? What's going on? Well, if you start dealing with catatonia, this can get a lot more pronounced. So I'm going to look at this description here. So it could be that you are unable, you can't finish some kind of routine activity or move from one activity without being prompted externally by another person. So you might stop between mouthfuls of eating until someone says, hey, are you all right? Or maybe touches you lightly on the arm to remind you to keep eating. A person who previously traveled independently may sit on a chair and be unable to get up in time to catch the bus or train, and thus be late or miss events altogether. This certainly happened to me. And in fact, some version of this has happened to me even when I'm not fully catatonic, right? When I'm just stressed out or partly in burnout. But it certainly can get more and more severe as a result of catatonia. And what I've seen from talking to people is that people don't always exactly know what's going on that's making it hard or impossible for them to get up and go about their daily routine. So sometimes they'll just blame themselves, or they'll say broadly, I think I'm having more executive function challenges. I can't get out the door in the same way. Or they may really shame themselves or feel very guilty about it. But if you look at what's actually going on in these moments, they are getting frozen or stuck. So just be aware of that feeling of frozenness and stuckness, especially if it seems to be interrupting you a lot during your routines and stopping you from finishing routines in the way that you used to be able to do. Because combined with other things, that could be a sign that you're dealing with some catatonia. Movement abnormalities. Catatonia is often expressed through problems with your motor system, right? Through your movement system. And some of the things that can happen as a result of catatonia are really distinctive and look a little strange if you haven't seen them before. As someone who has been through these things and had these symptoms, I feel like I could say, looking back, I think, oh, maybe that looked kind of bizarre to the people around me. And in some cases here, I'm just going to show you little clips because I think that will be a lot clearer than trying to describe what these things look like. And I should also mention as we get started that one kind of movement abnormality is just to slow down. You might have a harder time staying in continual movement. You might move less. These are all things that on the one hand can be forms of autistic regression because they mean your symptoms are getting worse, but they're also movement abnormalities in the sense that you're not moving in the way that you usually do. But the things that we're about to look at here are not, for the most part, symptoms of ordinary autism. They are only symptoms of catatonia. And so if you see them, they can be especially useful at helping you figure out what's going on. All right, so the first of these is rigidity. If you remember from the story at the very beginning, the poster said that her little sister was making her whole body stiff. That's a classic symptom of catatonia, and we're going to look at a picture of this by way of this video clip.
Just relax this leg for me. Can you relax it?
Okay, so the next thing that we're going to look at is called posturing or catalepsy. These traits look a lot like that rigidity because they involve being totally still in a way that's a little bit unusual or that seems hard to explain. But posturing or catalepsy refers not to holding yourself still when someone else is trying to move you around or bend you, but rather just staying still, especially in an awkward or strange position for no reason. So let's look at this clip. Waxy flexibility is a lot like the two traits that we've just seen in that it starts with stiffness, then the limb will gradually, slowly bend up and get more limber.
Go ahead and relax. Very good. Okay.
So now we're going to move on to another broad category. This one is really important, and it has to do with behavior that might be described as challenging behavior. These are actions that can create problems in your environment, and in some cases, they are actually dangerous in themselves, either to the person suffering the catatonia or to other people in the room or interacting with the person. And they often look a lot like what we in the autism community call meltdowns. Right? So if you know what an autistic meltdown is, you already know a lot about the symptoms that we're going to look at in a minute. And the broad takeaway here is that increased meltdowns or increasingly severe meltdowns can definitely be caused by catatonia. There's more and more literature, scientific literature, making this point. So I hope that awareness of this is going to really increase. So let's begin by taking a look at negativism, which we saw in the story that we've reviewed already. Negativism in its simplest form just means refusal. It can involve refusing to do something non-verbally, or it could also involve saying no in a really adamant or vocal way. My own sense, and this is not medical, right? This is just my own intuition as someone who has been through this, is that sometimes if a person says, no, I don't think I'll do that, or I don't want to do that, it may be because they can't. There's some kind of breakdown between the will and the body, but the person who's experiencing that breakdown doesn't exactly understand what's going on themselves. And so they kind of articulate it both to themselves and to the other person as well as they can by saying, oh, I don't want to. Now, again, that is not a clinical insight. That's a speculation on my part. So you can see how someone might misdiagnose or misrecognize what's going on here and miss the fact that this refusal is actually a sign of the onset of catatonia. Here on this slide, I've said that this negativism could look like teenage rebellion, like passive aggression, like deliberate defiance. I have been misunderstood at various points in my living environments, not just by parents, but also by roommates later or partners who think that I'm doing something because I'm being difficult, not understanding that I actually can't follow the instruction in the moment. And now I have a much better vocabulary to articulate what's going on. But the misunderstandings that can arise as a result of this catatonic symptom can be really painful. And it's important as much as possible to avoid attributing intent to someone who is experiencing this negativism. This can be especially tricky in situations where this negativism comes along with a rise in aggressive or erratic behavior, which can also be part of catatonia. And this is what we're going to turn to now. This is kind of a difficult topic. Those people who have been through violent meltdowns might understand or recognize the really sort of painful details of these experiences. So this is a little bit of a trigger warning. I want to start by talking about self-injurious behavior. Sometimes people resort to self-injurious behaviors to interrupt something even more intolerable that's happening inside them. It can take the form of hitting themselves, right? Some people pound their legs. Some people headbang. That can be quite dangerous on the wall or on the floor. Some people bite themselves or scratch themselves. You know, as you can imagine, basically any sort of act of lashing out against oneself or against one environment that causes harm or pain can come under the category of self-injurious behavior. And we would also include other kinds of self-harm in this category. So, for instance, if someone had a tendency to cut, that would be a self-injurious behavior. One thing I would like to point out here is that really intense scratching can be an SIB. So if you have a habit of scratching because your skin is dry, but you notice that it's becoming more and more severe and you are drawing blood, you might not instantly categorize that as an SIB because it's not nearly as dramatic as something like banging your head against a wall, but it is clinically considered self-injurious behavior. This kind of behavior has a wide range, right? Some people have some experience of it, but it's pretty intermittent. And when it happens, it's mild. They might pound on their head with their fists and get a headache, but they might not actually bang their head on the floor and risk serious injury. The risk for real harm is pretty high. Well, as Lachtel has demonstrated, these SIBs can be caused by catatonia, okay? And treating the catatonia can radically reduce the self-injurious behavior. And I think we're seeing increasing attention and understanding of this point, but it could be a lot more widely known. So I really want to emphasize it here, even though it's a tough subject. So this self-injurious behavior also has another side, which is perhaps even less frequently discussed, which is the possibility of injuring others or lashing out at others. People who deal with severe meltdown or violent meltdown know this risk, but also those who don't have autism and who may just be neurotypical people with catatonia sometimes experience a similar kind of combativeness. It's possible that you may experience a kind of combativeness which leads you to be a serious danger to other people. So again, this is a really devastating thing to go through. And the point that I really want to make right now is that it's important not to just sort of throw this in a grab bag of challenging behavior, or even see it merely as a symptom of autism itself. But to see that, especially when it's accompanied by some of the other symptoms we're looking at, it could actually be produced by catatonia, and it could be a symptom of catatonia. This is another feature of catatonia, which is sometimes a feature of meltdowns. It's called excitement. It means being extremely hyperactive. The one thing I want to point out from this slide is that endless, frenzied movement or motor activity can actually be dangerous to the person who is going through it. And then this last one is impulsivity. Let's look at this description here. If someone suddenly engages in inappropriate behavior, like running down the hallway, starting to scream, taking off all their clothes, or even some clothes for no reason, this can be a symptom of catatonia, which is really counterintuitive, because when we think of catatonia, we think of being totally still. We think of the patient lying in the bed. So this is almost the opposite of what our normal stereotype might be, but medically speaking, it can be a really important symptom. Okay, so the next cluster of symptoms that I've grouped together are combined here because they relate to what we might call an autistic shutdown. Shutdowns result from someone becoming totally withdrawn. So if a meltdown is someone exploding because their nervous system is totally haywire in some way, a shutdown is someone kind of imploding. They may stop eating, they may stop talking, they may dissociate really heavily. That's something that happens to me when I'm shutting down, is I get very dissociated. They end up staring, but staring almost off into space with a very fixed gaze that doesn't move. And if your pattern of eating changes dramatically, that's another thing to really watch out for. We can develop something that's a bit like a stutter, right? Or lots of hesitations. We might start talking in a whisper or a mumble. When I was dealing with catatonia, before I became actually non-speaking, right? I had verbal breakdowns that lasted for weeks, and I was not able to speak fluently for quite a while. But in the sort of run up to that phase, I often felt as if I couldn't quite enunciate clearly, right? As if my mouth was really tired, as if my tongue was thick. I just wasn't able to articulate as well. And that was part of the motor difficulties that I was having in general at that time. But there are also cognitive issues that can contribute to this deterioration of speech. In my case, I sometimes lose the ability to talk about myself in the first person. I use inappropriate pronouns for myself, and I don't exactly know how or why that correlates to catatonia. I just know that it's a feature of catatonia and burnout for me. I seem to be less and less able to sort of interpolate myself into a social situation as my burnout becomes more severe. And that's definitely a feature of a phase of catatonia for me. So if you see that someone's eccentricities of speech are really increasing, if you see them less able to sort of position themselves socially in appropriate ways through speech, and they're speaking about themselves more and more as if they were a character in a book, if they're not able to establish a clear frame of reference, so they start speaking and you don't know what they're referring to. These are not things I've seen in the reading I've done. They're just things that happen to me and that I have seen described by other people. And then there are also all of these ways that the slide talks about that speech can decline because of these motor problems that I was mentioning. Okay. And then the other thing that I want to flag is called autonomic abnormality. And this basically has to do with any way that your body is going haywire at its most basic autonomic levels. So your autonomic system regulates your heart rate and your body temperature and all these other things that you might take for granted. But sometimes when you're dealing with catatonia, these things get to be a little off. So your temperature might be all over the place, your blood pressure might be strange, your pulse might go a little crazy. You could have periods of heavy sweating. I know that some people have severe night sweats. I did. I had night sweats that I couldn't explain. And I also was wearing a Fitbit at the time, and I noticed, because I was looking at my Fitbit data, that my pulse had started to really wild out. So, I'd see spikes all the way up to 150 and then dramatic drops and really crazy patterns, even though at that time I wasn't really working out. I was pretty sedentary and around my apartment. And at one point I even took a screenshot of my Fitbit data and I sent it to my doctor, and I thought I was probably having panic attacks, which I also was sometimes at that point. But looking at that data now, it's much easier for me to correlate that instability of my heart rate with what I know are the symptoms of catatonia. And then the last thing that I want to look at is just this slide about autistic burnout. This is a slide produced by Actually Autistic Alien. When we talk about burnout, we're talking about something that can look quite a bit like catatonia. And in my view, there is actually a pretty great overlap between mild catatonia and moderate to severe burnout. And it's likely that a lot of times we're using those two terms to describe the same thing. This is an area that needs further research and I think is being investigated even these days. So some of the signs of burnout are loss of skills, seeming more clumsy, right? These are, as we've noticed, also typical of catatonia because of that motor decline, exhaustion, memory loss, not getting things done. Okay, so that not getting things done can come about because you're having a hard time with your ADLs, because you're getting frozen and stuck, because you're having a harder time getting out of bed or getting to your desk or what have you. Seeming, quote, more autistic, that can be the result of that autistic regression that we've been talking about. We've seen a lot of examples of people seeming or feeling more autistic. Digestive issues. It's not uncommon for people's digestion to go a little bit haywire, partly because their nervous system is going haywire. So if you have a real spike in indigestion, for instance, if your appetite goes crazy, if you notice other things are off with your eating, this can be a function of catatonia because it has to do with the way your nervous system is not correctly regulating your digestion. Having more meltdowns, right? We talked about that as a possible symptom of catatonia. Feeling really exhausted and down and withdrawn. So I think by now you can see there's a tremendous possible correlation between burnout and catatonia. That's not to say that they're always the same thing. Sometimes burnout is just burnout. Sometimes burnout might be mild catatonia, but it's so mild that it's not something we have to pay super close attention to. But it is the case that when you become burnout in that autistic sense, it's really important to look for some of the other features of catatonia because catatonia can be dangerous. So if you'll see here under how to deal, rest a lot, stim as much as you want, try not to mask. Don't worry so much about sort of faking it for other people, having to make eye contact, all of these other things. Give things some time, be kind to yourself, engage in your special interests, set boundaries, schedule your day, be mindful, ask for help. Okay, these are all really good and important things to do with catatonia as well as burnout. Routine and schedule is really vitally important no matter how catatonic we are. So even when I was largely bedridden and my mother had to check on me a lot, it was a lot easier when she was able to come in at a time that I expected. Then at some point she started knocking as I was getting better and sort of more aware, just to let me know she was coming in. That was really helpful. So the more predictable our environment can be, the better, no matter how sick we are. The more the boundaries of our environment are clear, the better, no matter how sick we are. Autistic people tend to need a lot of time and room for introspection. And when we've lost those things because we're sick, it's very challenging. The one area where we don't see a strong correlation between burnout and catatonia in terms of steps toward recovery has to do with our tendency to retreat. So when I'm dealing with run-of-the-mill burnout, I might take a sick day from work if I can. I might go hole up in my office for a couple days. I might tell people that I'm not able to speak for 2 or 3 days. I might start using my talker before I absolutely have to because I know that it will enable me to recover faster. Some of those things are actually really helpful if you're dealing with catatonia or with burnout. But the retreat back into quiet spaces, the going to bed, right? The resting, the ceasing all activity. If you do that long enough, that can actually make your catatonia more severe. Be really wary if you have gone to bed, if you are totally self-isolating and you feel like your symptoms are not getting better in the way that they normally do and might actually be getting worse, that could be a sign that you should talk to your doctor about catatonia, because you may need some other strategies to help you recover from this more complicated form of burnout.